A 34-year-old woman visits a fertility clinic with her husband with concerns about their inability to conceive their first child. She reports a long history of vague lower abdominal pain, along with changes in her menstrual cycle such as spotting and irregular vaginal bleeding with passage of clots for the past few months. The patient denies pain during intercourse, postcoital bleeding, foul-smelling vaginal discharge, fever, or weight loss. Her physical examination is unremarkable with no signs of acute illness. During the physical examination, a healthy vagina and mild bleeding from the cervix are noted. The patient is subjected to a hysterosalpingogram as part of her infertility evaluation, which shows sinus formation and peritubal adhesions. Subsequently, a sample of menstrual fluid is taken to the microbiology lab. Which of the following pathogens is most likely to be the cause of patient's complaints? Timer starts now. Correct answer is Z. Although rare in developed countries, chronic endometritis caused by M. tuberculosis is a leading cause of infertility in women from endemic countries, with Nepal and India being countries with relatively high cases of upper genital tract infection by M. tuberculosis. The majority of subjects with the infection are almost asymptomatic, with infertility being the only complaint. When clinical manifestations arise, they usually consist of irregular vaginal bleeding and vague lower abdominal pain. The main tool to diagnose these patients is a hysterosalpingogram, which can show typical findings of tuberculous endometritis, such as sinus formation, rigid pipestern patterning, beating, and sacculation. The treatment for this condition consists of anti-tuberculous therapy for 9 to 12 months. If not resolved, a more radical procedure, such as total abdominal hysterectomy and bilateral salpingo-oophorectomy, provide definitive treatment. It is important to instigate early aggressive medical therapy for those women who wish to attempt a future pregnancy. Option A, endometritis caused by Neisseria gonorrhea is seen in the context of acute pelvic inflammatory disease or PID, in which it presents with severe lower abdominal pain, usually bilateral, that worsens during sexual intercourse or during menses. Although PID is associated with infertility, the lack of overt clinical manifestations in this patient makes this diagnosis unlikely. Option B, genital chlamydia trachomatis. Although mostly symptomatic, many patients present with subtle clinical manifestations or even without symptoms, presenting years later as chronic pelvic pain. The patient in the above vignette shows none of the cardinal symptoms of PID and no purulent exudate was present during the vaginal examination. Option C, Group B Streptococcus. Streptococcus agalactiae is an infectious agent that readily colonizes the genital and gastrointestinal tracts. It can also result in skin and soft tissue infections as well as bacteremia. It is usually seen affecting the urinary tract in elderly adults, causing cystitis, urethritis and pyelonephritis. It rarely invades the upper genital tract in non-pregnant women. Option D, the infection of the urogenital tract by Mycoplasma genitalium is a recognized sexually transmitted infection or STI, causing cervicitis and non-gonococcal, non-chlamydial PID in women, and urethritis in men. Although it shares the clinical manifestations of chlamydial PID like lower abdominal pain and foul-smelling vaginal discharge, the association of Mycoplasma genitalium PID and infertility is less strong, as observed with other infectious agents. Other symptoms of M. genitalium infection include dysuria, vaginal itching, and pelvic discomfort. Learning objective: chronic endometritis secondary to Mycobacterium tuberculosis is the leading cause of infertility in developing countries and should be suspected in patients exposed to endemic areas. Medical therapy for extended periods of time is the standard of care, while radical surgery is reserved for unresponsive cases. That's all. Please hit the thumbs up button. Please hit the like button and please subscribe to my YouTube channel so you'll be notified if there's a new video.